Hi everyone, welcome to the Her Sacred Place channel. Today we will be discussing the importance of ovulation for women who are trying to get pregnant. If you haven't already, make sure to like this video and subscribe to this channel so you will be notified each and every time I upload a new video. Alrighty then, let's talk ovulation. So first we must understand what a healthy menstrual cycle is in order to understand how ovulation falls into it. A healthy menstrual cycle length, which refers to the number of days from one period to the next, must not be confused with period length. Period length refers to the number of days one's period has lasted. A healthy menstrual cycle is typically between 28 to 30 days, averaging about 29 days. There are 4 phases of the menstrual cycle, each lasting about 7 days. The first phase is when the period occurs and is referred to as day 1. It is important to note that spotting and not full-on bleeding denotes day 1 of the menstrual cycle. Some women mistakenly count day 1 when they are fully bleeding because they may have had a few days of spotting before bleeding actually occurred. While that is an imbalance in itself, we can leave that for a future video. Again, the onset of spotting denotes day 1 of the menstrual cycle. During this time, one is shedding the lining of the uterus because pregnancy has not occurred. The second phase is referred to as the follicular stage. This is the time between the period and ovulation. Here, estrogen levels begin to rise and the egg matures and is prepared to be released from the ovaries. Simultaneously, the uterine lining begins to build back up again to prepare for conception. The third phase is ovulation and the main topic of this video. During this time, the egg is released from the ovaries and travels through the fallopian tube to be fertilized. As a side note, luteinizing hormones are responsible for signaling the ovarian follicle to tear and release the egg. So when you purchase any ovulation test, it measures the amount of this particular hormone in the urine to determine if ovulation is close to occurring or not. The fourth and final phase is called the luteal phase. During this time, the body basically prepares for either pregnancy or the period to return. Here, the uterine lining produces chemicals that will either help support a healthy pregnancy or will prepare the lining to break down and shed if pregnancy doesn't occur again, thus completing the cycle. And then at this point in time, we'll start back over with phase 1, which is the period again. Now that you are aware of how ovulation falls into the menstrual cycle, let's just talk about it a little bit more. To recap, ovulation refers to the point in time when the egg is released so pregnancy can occur. With that being said, please understand that a female cannot get pregnant when she is not ovulating or no egg is being released. This is the reason why women who track their menstrual cycle as a natural form of birth control do not have sex when they're ovulating. According to Western gynecology, ovulation is supposed to last around 24 hours. In a healthy menstrual cycle free of imbalances, ovulation usually occurs midpoint, let's say around day 14. However, it has become standard to use days 13 through 15, and I usually recommend to my clients days 12 through 17 when they are steaming for fertility, unless we have really gotten them down to a truly imbalance-free menstrual cycle. Symptoms of ovulation include an increase in body heat and libido and healthy vaginal fluids. Whenever a woman experiences headaches, cramping, pain, or other type of symptoms, this denotes a womb imbalance. Once the imbalance has been corrected, she no longer experiences these type of problems while she is ovulating. It is difficult to get pregnant if a woman does not know when or if she is even ovulating. Remember, a woman cannot get pregnant if ovulation does not occur. Although we have talked about when ovulation should occur in a healthy menstrual cycle, remember the days 14 through 16, some imbalances can cause a late, early, or no ovulation at all. Late ovulation, usually when ovulation occurs past day 16, results from an imbalance we call stagnation. Here, the uterus does not give the signal to get ovulation going on time, so it occurs late. If you would like to hear more about stagnation in the future, make sure you leave a comment below. In early ovulation, which is when ovulation occurs before day 14, a woman typically experiences an imbalance referred to in traditional Chinese medicine as uterine fatigue. In this instant, the uterus is suffering from fatigue and cannot extend the cycle out to a healthy 28-day length. Thus, ovulation is basically being shortened. If you would like to hear more about uterine fatigue in the future, make sure to leave me a comment in the section below. Anovulation refers to the failure to ovulate and can result from a few things going on. It could be caused by stagnation because the uterus is not circulating properly. Could be caused by a blood deficiency because the body is trying to keep from getting pregnant due to the lack of nutrients that are already in the blood. Or extreme dryness in the vagina could cause anovulation because fluids are very, very necessary to nourish the follicle. If you would like for me to go into more detail about either of these imbalances as it relates to anovulation or failure to ovulate, feel free to leave a comment below. Vaginal steaming cleanses the womb and rids it of any imbalances. Therefore, vaginal steaming can lead to healthy ovulation. If a client is actively trying to get pregnant, I recommend they steam 3 to 5 days after the final spot of their period. If the client is not actively trying to conceive, then I recommend steaming a few days before or after their period, depending on any other imbalances they may or may not be experiencing. Since vaginal steaming cleanses and rebalances any imbalances in the womb, if a woman is suffering from problems with ovulation, usually that gets cleared up after a few rounds of vaginal steaming. If you like this video, be sure to give it a thumbs up and leave a comment below if there are any topics you would like me to discuss in the next video. Until next time, happy steaming!